evaluating patient and provider preferences for once-weekly basal insulin in adults with type 2 diabetes. Hello, my name is David Kerr, and on behalf of my fellow authors, I am pleased to provide an overview of this manuscript. Insulin is considered highly effective in managing type 2 diabetes, but various factors can impact insulin initiation or intensification, thereby affecting a person's adherence to a prescribed insulin regimen. Although currently available subcutaneous basal insulin formulations are dosed once or twice a day, missed or mistimed doses of this type of insulin are very common and can negatively impact blood glucose control, putting individuals at risk of serious complications associated with type 2 diabetes. As new insulin formulations become available, it is important to understand the preferences of people living with type 2 diabetes and their healthcare providers compared to existing basal insulins. This study examined the perspective and the perceptions of professionals and adults with type 2 diabetes, those currently taking a basal insulin, and also individuals who were insulin naive regarding once-weekly basal insulin relative to once-daily preparations. These latter ones, the once-daily, are currently the standard of care. This study also sought to understand similarities and differences between individuals with type 2 diabetes, their treatment preferences, and also professionals' prescribing decisions. In this study, adults with type 2 diabetes who were insulin naive or established insulin users, and those who were injection naive or injection experienced completed a self-administered online discrete choice experiment, or DCE. Diabetes educators, physicians, nurse practitioners, and physician assistants in primary care and endocrinology also participated in the DCE. Overall, most respondents would choose a once-weekly basal insulin product over another type of basal insulin. The insulin type and delivery methods were attributes considered to be of the highest importance to both people with type 2 diabetes and professionals. Both insulin experienced and insulin naive patients were likely to ask their doctors about using a once-weekly preparation when they were presented with a description of the hypothetical treatment. Primary care providers and specialists in our survey were equally willing to educate patients on the management of the type 2 diabetes using a once-weekly preparation. The results of the study are important for the future of diabetes care because different dosing approaches have the potential to result in improved clinical outcomes and also reduced healthcare costs. Thank you for the opportunity to discuss this study.